Hello, I'm Sandy, Sandra Morton-Nance. I'm the hospital liaison nurse specialist for learning disabilities based at Broomfield Hospital, Mid-Essex Hospital Trust. My role on a clinical level is to coordinate the patient with learning disabilities journey through the hospital from pre-admission stage to post-discharge. And I cover the assessments like mental capacity, dependency assessment, and we use the passport, hospital passport, and it gives the hospital staff, the medical staff, important information about the patient coming in and any complex needs that have been highlighted and how we can best approach their care and meet their care needs so that treatment is equitable and accessible for this client group, because in the past history has shown us that mistakes are made and the needs of the person with a learning disability is misunderstood or not understood greatly.
I'm Catherine Field and I'm a support worker working in supported living with adults with learning disabilities. We've been putting together hospital passports with people in this scheme for the past year, mainly because we found that there's been an increase in people going into hospital and a decrease in the amount of support that we can give them while they're in hospital. And so one of the most important things we've found is that there's really good communication between ourselves, any other supporters like family or advocates, and the people who are actually treating the clients in hospital.
Hi, I'm Kirsty Michael and I'm a theatre practitioner and I work as part of a multidisciplinary team at Broomfield Hospital. My experience of working with people during the last 7 years has taught me that you should never make assumptions about a particular person just because either the way they look or try and communicate back to you. For instance, if they can't talk to you, it doesn't necessarily mean that they can't understand what you're saying back to them. Just because they can't move or are in a wheelchair doesn't necessarily say that they can't walk a short distance or that they don't enjoy exercise or joining in team sports with other people. With the disabilities I've worked with, my knowledge has grown profoundly because I've managed to begin to understand where they're coming from, in the sense that I've learnt to communicate with them clearly and more to the point, instead of giving them long words, you know, shortening them down, talking directly to them, and even if they're slightly deaf, you know, maybe standing to want the good side rather than the bad side and looking directly at them in their face, because obviously some of them can lip read as well even when they can't hear. My work with Carol entails supporting her to live in her own environment at home and to be able to do daily chores and exercises and live as full a life as possible. Okay, so for you, Carol, it's easier if I talk to you slowly and show you pictures as I'm describing things. So a bit like your hospital passport, I know that if I open it up that you need to have pictures to help you understand things. Is that right? Mm. And that you have epilepsy. And it all tells you all here, doesn't it? And you can do your own medication with a little bit of guidance.
When we start looking at the hospital passport, what I do is sit down one-to-one with a service user and we look at the reasons why they've been in hospital and their health needs. We often work in conjunction with the Community Learning Disabilities team who put together the health action plan. And we draw on the main points that people need to know about a service user. Medication, what is essential medication and the times that they need to be taken, because it's so important when you go into hospital and the hospital take over the dispensing of medication that there is good communication to avoid people getting double doses or not having the medication at all. And also so the service user knows that they can rely on whoever is supporting them to give them what they need, what is right for them. Because this passport sits on your bed, doesn't it? And it's there for you to look at and to show people. And if you remember, it says here all sorts of things like what you like to eat.
Yeah.
And how you like to take your tea. And also,
Good boy.
this is about your cat, isn't it? Yeah?
Yeah.
And that you like people to talk to you about him. Another part of the hospital passport is very much around someone's communication needs. People with learning disabilities have massively varying needs, and what can be very difficult needs to address in an environment where someone can be scared or feeling helpless. One of the most important things is that doctors and nurses and any support staff spend time sitting down with someone and going through their hospital passport to find out what is this person's main means of communication and what extra resources they might need to put in place to make sure that they're able to get the best out of the person being in hospital. So if they need to have some pictures there, or if they need a board that the person can draw on or write on, then it's really important that those things are noted down and put in place, and also passed on to the rest of the team who are going to be supporting the client in hospital. We identify each of those things in the hospital passport. So if someone uses photographs or pictures, if someone uses Makaton, or if someone might just clam up because they're frightened in a different situation, it's all identified, and it's something that the doctors and nurses can discuss as a matter of their care plan.
Within Mid-Essex Hospital, Broomfield Hospital, what we've done is sent out to all the wards and departments a communication resource file, which is a purple file we use, which contains a lot of symbols, objects of reference, pain thresholds, body parts, lots of things like that that are easy read, easily accessible, and they're in this nice vinyl. They're covered in with the vinyl so that they're easy to keep clean, and there's no problems with infection control and things like that that the hospitals like to think about. Oh, I've got these pictures here. Do you remember this when we talked about pain you were in from your knee because you came into hospital after a fall and you'd hurt your knee, hadn't you? So where would you put yourself on here when you measure that pain in your knee? We've got a happy smiley face which says there's no pain at all, and we've got this very unhappy face with tears in their eyes, look, which says this is really bad pain. And this one is okay, and that one's a little pain. So it's like no pain, I'm okay, some pain, bad pain.
I think any communication document can help someone assess someone's capabilities and someone's needs when they're in hospital. In terms of capacity, certainly capacity to consent to any treatment that they're going to receive, I think it's absolutely vital that doctors sit down with this sort of communication aid, find out what someone's capability is in terms of making decisions for themselves, who else they need to involve, and how they're going to go about assessing whether that person understands the treatment they need to receive or have an option to receive before they actually make any decisions based on the fact that someone has a learning disability.
They should read my passport so they know how to treat me.